Hi guys, let's talk about dementia today. So, dementia people think is just a memory loss, but it's the decrease in the cognitive ability of a person that affects the functionality of the person. So, when we talk about cognition, memory is just a part of it, a small part of it. It also includes perception, thinking, reasoning, knowing, your creativity, your planning, problem solving, your language, imagination, decision making, attention, emotions, whatnot, even coordination. So, when somebody is having issues with all these things, or few of these things, and that is affecting their functionality, then we are talking about dementia already. And then dementia can be mild, moderate, severe, and something called mild cognitive impairment is also there, where we're not exactly into the dementia range, but we are all struggling with many of these things. So dementia can be classified broadly in several ways. One would be like based on severity, mild, moderate, severe, of course. Then based on progression, something is progressive, slowly progressive, rapidly progressive. And most importantly, reversible and non-reversible. So far, the reversible dementias are the ones where we can do something to fix the dementia. The memory will come back to normal. It also includes pseudo-dementia, like memory issues or cognitive issues when we have behavioral problems like depression, anxiety, all the different plethora of things that come under behavioral health that also affects our cognitive abilities. So once we fix that, then the cognition comes back to normal. Now, the other things that are reversible are vitamin deficiencies. Certain vitamin deficiencies like vitamin B12 deficiency can cause issues with memory. Certain toxins like when we have diabetes and too much sugar in our system can damage any cell of our body, including the brain cells, and that can cause dementia, which is kind of reversible if we fix it. If we wait too long, any reversible dementia can become permanent if the damage is too much. Now, the other reversible dementias are like if you have certain kind of infection that can be fixed and the memory gets better or back to baseline. So, and then some metabolic derangements like your thyroid hormone. If somebody is hypothyroid, they can have reversible memory loss. Once it's fixed, memory gets fixed. All right. Now, there is this irreversible dementia, irreversible till now. In the future, it might not be so. But for now, the ones are the neurodegenerative dementias like Alzheimer's, Lewy body dementia, all the different dementias, frontotemporal dementia, that have some abnormal protein accumulate in the brain cells. Even post-traumatic dementias can have abnormal protein deposited in the brain, which can keep increasing over the time, and there is no way to clear out these abnormal proteins. We have some chemicals that are now being in use, FDA approved, but not very useful. They're very limitation, too many side effects, and only certain criterias if people have can qualify for getting these medications. These are antibodies, monoclonal antibodies, and the future is bright, but we are not there yet. So these dementias are basically symptomatic management and taking care of the person himself and the family at large, because there is a huge caregiver burden when people are going through degenerative dementia, which is a slowly progressive disease. And the other thing that come under irreversible dementia is vascular dementia, like when you have damage to the cells in your brain because of poor circulation. And there can be strokes, other things that also compromise circulation to the brain can cause it. So bottom line, if you're having issues with your cognition, don't feel shy to reach out to your physician, because there are many things that can be done to make the memory better, because dementia is a syndrome. There isn't a single thing that's causing it, most likely. Even if you have neurodegenerative dementia, if we have neurodegenerative dementia, there could be other things that are kind of coexisting and contributing to their memory and cognition. So those can be fixed at least. So if anybody in your family or your dear ones have issues with memory, please reach out to your physician. All right, take care. Bye now.